Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Low-dose aspirin for peak, altered localized colorectal cancer. Background. Aspirin reduces the incidence of colorectal adenoma and colorectal cancer among high-risk persons. Observational studies suggest that aspirin may also improve disease-free survival after diagnosis, particularly among patients with tumors harboring somatic pica mutations. However, data from randomized trials are lacking conclusions. Aspirin led to a significantly lower incidence of colorectal cancer recurrence than placebo among patients with pica hotspot mutations in exon 9 or 20, and appeared to have a similar benefit among those with other somatic alterations in peak pathway genes. Next article. Orforglipron, an oral small molecule GLP-1 receptor agonist, in early type 2 diabetes. Background. Orforglipron is a small molecule, non-peptide glucagon-like peptide 1, GLP-1, receptor agonist in clinical development for type 2 diabetes and weight management. Additional data on the efficacy and safety of orforglipron are needed. Conclusions. In adults with early type 2 diabetes, orforglipron significantly reduced the glycated hemoglobin level over a period of 40 weeks. Next article. Oral semaglutide at a dose of 25 mg in adults with overweight or obesity. Background. Oral semaglutide at a dose of 25 mg may provide an alternative treatment option to injectable semaglutide, 2.4 mg, and higher dose oral semaglutide, 50 mg, for persons with overweight or obesity. Conclusions. Oral semaglutide at a dose of 25 mg once daily resulted in a greater mean reduction in body weight than placebo in participants with overweight or obesity. Next article. Proportional assist ventilation for minimizing the duration of mechanical ventilation. Background. In critically ill patients, acceleration of liberation from mechanical ventilation is important in order to reduce the risk of complications and to improve long-term outcomes. Whether the use of proportional assist ventilation with load adjustable gain factors, PAV+, results in a shorter time to successful liberation from mechanical ventilation than pressure support ventilation, PSV, is unclear. The time to liberation from mechanical ventilation did not differ significantly between the group that underwent PAV+ and the group that underwent PSV. Next, we will be discussing articles from Journal of American Medical Association. Prediction of platelet transfusion outcomes in preterm infants with severe thrombocytopenia. Question: when and in which preterm infants with severe thrombocytopenia do platelet transfusions reduce the risk of major bleeding or death? Findings in a multicenter cohort of 1,042 infants with severe thrombocytopenia. This study developed a decision support algorithm, estimating the absolute risks of major bleeding or mortality if prophylactic platelet transfusion were or were not to be given. Evaluation in a separate cohort, N equals 637, indicated good performance, meaning the findings show substantial variation in benefit and harm of platelet transfusion for severe thrombocytopenia, depending on the infant's current condition. The algorithm's risk estimates could help clinicians individualize prophylactic platelet transfusion decisions. Next, we will be discussing articles from Annals of Internal Medicine. The cost-effectiveness of semaglutide and Tirzepatide for patients with knee osteoarthritis and obesity. Background. Glucagon-like peptide 1 receptor agonists, GLP-1 RAs, lead to substantial weight loss and pain reduction in persons with knee osteoarthritis and obesity. Conclusion. Both Tirzepatide and semaglutide would be widely considered cost-effective when compared directly with usual care. Tirzepatide would offer the most favorable return on investment to decision-makers whose cost-effectiveness thresholds exceed $57,400 per collie. Next, we will be discussing articles from British Medical Journal. Second cancers in 475,000 women with early invasive breast cancer diagnosed in England during 1993 to 2016. Objective to describe long-term risks of second non-breast primary cancers and contralateral breast cancers among women with early invasive breast cancer after primary surgery. Conclusions. The risk of a second primary cancer in women treated for early invasive breast cancer is slightly higher than for women in the general population. Contralateral breast cancer accounts for around 60% of the overall increase, with higher risks in younger women. The risk associated with adjuvant therapies is small. Next, we will be discussing articles from Lancet. Paclitaxel-coated versus uncoated devices for infrainguinal endovascular revascularization in patients with intermittent claudication, SWEDPAD 2, a multi-center, participant-masked, registry-based, randomized controlled trial. Background. Drug-coated devices are widely used to reduce restenosis after lower limb revascularization in patients with peripheral artery disease, but their effect on patient-centered outcomes remains unclear. We assessed the effect of paclitaxel-coated devices on clinically important outcomes in patients with intermittent claudication undergoing infrainguinal endovascular revascularization. Interpretation. In patients with Rutherford stage 1 to 3 peripheral artery disease undergoing infrainguinal endovascular revascularization, paclitaxel-coated devices did not improve disease-specific quality of life at 1 year compared with uncoated devices. All-cause mortality was not different over the total follow-up time, but significantly higher over 5 years. These findings do not support routine use of paclitaxel-coated devices in this patient population. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from JAMA Oncology. Established cancer predisposition genes in single and multiple cancer diagnoses. Question. What is the association between pathogenic variation in previously implicated cancer predisposition genes and single and multiple primary cancer diagnoses in a population-based genetic association study? Findings. In this genetic association study of 183,627 participants, carriers of rare pathogenic variants in 16 genes were associated with at least one cancer diagnosis. Several well-established associations were confirmed in this analysis, particularly in DNA damage repair genes. Carriers had 1.9-fold higher odds of a single cancer and 2.6-fold higher odds of multiple cancers, meaning individuals with multiple primary cancer diagnoses may benefit from gene panel testing. Population-based methods minimize selection bias and can refine previously identified risk estimates. Next, we will be discussing articles in the field of rheumatology. Falls among individuals with systemic lupus erythematosus, an observational study. Objective. Systemic lupus erythematosus, SLE, is thought to accelerate the aging process. However, there is limited research on geriatric syndromes, such as falls, in this potentially vulnerable population. This study aimed to describe the prevalence of and contributors to falls in the SLE population. Conclusion. Falls were common in our cohort, regardless of age. Our results suggest potential interventions for reducing falls, like better control of SLE, physical therapy, depression screening, and medication review. Next, we will be discussing articles in the field of cardiology. Here are the articles from Journals of the American College of Cardiology. Safety and effectiveness of statins for primary prevention in adults with type 1 diabetes, an emulation. Background. There is no consensus for using statins for primary prevention of cardiovascular disease, CVD, and all-cause mortality in adults with type 1 diabetes mellitus, T1DM, because no randomized controlled trial has exclusively investigated statins in this population. Sought conclusions. Among adults with T1DM, Statin initiation for primary prevention was associated with reductions in all-cause mortality and major CVD with a very low risk of adverse effects. The differences in absolute risk reductions can help guide personalized statin treatment decisions in T1DM. From JAMA Cardiology. 1-year outcomes of coronary angiography after out-of-hospital cardiac arrest without ST elevation, an individual patient data meta-analysis. Question: what is the association of immediate versus delayed or selective coronary angiography strategies on long-term outcomes in patients with out-of-hospital cardiac arrest without ST elevation, and would patient subgroups benefit from a tailored approach? Findings: in this meta-analysis of 2 randomized clinical trials including 1,031 patients, immediate coronary angiography did not improve survival until 1 year after the arrest. No treatment by subgroup interactions based on demographic, clinical, or arrest-related features were identified that suggested heterogeneity between groups, meaning in this individual patient meta-analysis, immediate coronary angiography showed no benefit over delayed or selective strategies for survival up to 1 year post-hospitalization, and no patient subgroup derived preferential benefit from a particular treatment strategy. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Association between urinary phthalate metabolites and sarcopenia in U.S. adults from N. Haynes 2011 to 2018. Context: phthalates, widely used as chemical additives, are often found as mixtures in the environment. However, the combined impact of phthalate exposure on sarcopenia remains unclear. Objective: this study aimed to investigate the relationships between phthalates and sarcopenia in adults. Conclusion: this study provides new evidence that co-exposure to phthalates might increase the risk of sarcopenia. Further research is needed to explore the causal relationship between phthalate metabolites and sarcopenia, as well as to elucidate the underlying mechanisms involved. Here are the articles from Diabetes Care. A multimodal predictive model for chronic kidney disease and its association with vascular complications in patients with type 2 diabetes. Model development and validation study in South Korea and the UK. Objective: to develop a multimodal model to predict chronic kidney disease, CKD, in patients with type 2 diabetes mellitus, T2DM, given the limited research on this integrative approach. See conclusions. Our multimodal AI model integrates fundus images and clinical data from binational cohorts to predict the risk of new-onset CKD within 5 years and associated vascular complications in patients with T2DM. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Association of increase in white matter hyperintensity volume with rate of hippocampal atrophy in a population-based study of aging. Background and objectives. Higher white matter hyperintensity volume, WMHV, is associated with hippocampal atrophy, cognitive decline, and dementia. However, it is unknown whether continually increasing WMHV is related to hippocampal atrophy. The aim of this study was to determine whether higher WMHV change rate, WMHVR, is related to higher hippocampal atrophy rate, HAR. This relationship is dependent on cardiovascular risk factors, CVRFs, Alzheimer's disease, AD pathology, and genetic risk, and this relationship is mediated by neuroaxonal degradation discussion. Higher WMHVR was associated with HAR between approximately 70 and 73 years, independent of CVRF levels, APepsilon-4 status, and a beta load, and not mediated by markers of neuroaxonal degradation. Although AD-specific pathology is typically considered the main cause of accelerated HAR, we demonstrated that HAR is also linked to deteriorating WM health. These results will need to be replicated in more diverse cohorts with longer follow-up periods to confirm the findings. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Investigating the long-term effects of COVID-19 infection on healthcare utilization in individuals with COPD background. Individuals with COPD are at elevated risk of severe outcomes following COVID-19 infection. Research question: does COVID-19 have a long-term impact on healthcare utilization, HCU, for individuals with COPD? Interpretation: in this study, patients with COPD who were positive for COVID-19 had significantly greater long-term HCU usage. Although Omicron has been considered milder than previous variants, it was still associated with significantly elevated long-term HCU. Individuals with greater than or equal to 3 vaccinations who tested positive for COVID-19 had HCU rates similar to those who tested negative, suggesting that vaccinations can reduce long-term HCU. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Molecular phenotyping of sepsis and differential response to fluid resuscitation. Rationale: biological heterogeneity in critical illness syndromes, such as sepsis and acute kidney injury, AKI, has hindered development of effective therapies. In sepsis-associated AKI, 2 molecular subphenotypes, SP1 and SP2, have been identified with differing characteristics, outcomes, and response to vasopressor treatment. It is unknown if these subphenotypes extend to all patients with sepsis and whether they respond differently to fluid resuscitation strategy. Conclusions: molecular subphenotypes previously identified in AKI are also identifiable in sepsis and respond differently to fluid resuscitation strategy. Future prospective identification of these subphenotypes could inform a precision-guided therapeutic approach in sepsis. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Sodium glucose cotransporter 2 inhibition and hospitalizations in patients with CKD, a meta-analysis of kidney outcome trials. In this post-hoc analysis of canagliflozin and renal events in diabetes with established nephropathy clinical evaluation, canagliflozin reduced the risk of first and subsequent all-cause hospitalization by 14%. Sodium glucose cotransporter 2 inhibitor reduced the risk of hospitalization by 15%, with consistent effects irrespective of kidney function, albuminuria, and diabetes status. Absolute reductions in hospitalizations with sodium glucose cotransporter 2 inhibitor in patients with CKD are substantial, with major implications for individuals and health systems. Here are the articles from Kidney International Reports. Prospective pilot study of plasma cell-targeted therapy with bortezomib in refractory IgA nephropathy. Introduction. IgA nephropathy, EGAN, is a leading cause of kidney failure, characterized by galactose-deficient IgA1, GD-IgA1, deposition and immune complex formation, aberrant trafficking of IgA plus plasma cells and autoantibody production, Ig or IgA, contribute to disease pathogenesis. Proteasome inhibitors such as bortezomib may modulate B or plasma cell activity and reduce pathogenic antibody production. Conclusion. Short-course bortezomib therapy led to sustained proteinuria reduction in patients with IgA, with an acceptable safety profile. These results support further evaluation in larger, controlled trials. Community-acquired acute kidney injury and late kidney dysfunction in survivors of COVID-19 hospitalization. Introduction. Data on the incidence and risk factors for renal long COVID are scarce. We aimed to investigate 2 acute kidney injury, AKI, phenotypes, namely community-acquired, CA-AKI, and hospital-acquired, HA-AKI, and the development of late kidney dysfunction in survivors of COVID-19 hospitalization. Conclusion. In conclusion, late kidney dysfunction affected 1 in 4 COVID-19 survivors. CA-AKI, but not HA-AKI, was an independent risk factor for late kidney dysfunction. These findings suggest that renal long COVID might be frequent, and that a specific AKI phenotype, CA-AKI, may play a crucial role in its development. Our research highlights the need for CA-AKI prevention and for the long-term follow-up and care of patients affected by this AKI phenotype during COVID-19 infection.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.